I'm Dr. Adams. I'm one of the pulmonologists at Our Lady of the Lake and at St. Elizabeth. We have a clinic out at St. Elizabeth, so if you guys feel at the end of this time you need to come see us, feel free to give us a call. This is, just because of the constraints of time, this is mostly about sleep apnea and then a little bit about insomnia, just because it's a smaller session. You can fill up 5 or 6 sessions on sleep apnea alone. So, and since it's the most common sleep disorder, we'll mostly talk about that. So, like I said before, well, it works this time. So that's just to get you thinking. So watch out what's coming for you. So obstructive sleep apnea is essentially what happens when you have repeated episodes where your upper airway closes off. You try to breathe and you can't breathe, and because of that, your oxygen levels drop. And so it's a big problem. What happens is your body fires off all these signals that says, you know, it's like if somebody grabs your nose and covers your mouth while you're breathing, that you send off all these signals. Your blood pressure goes way up. You wake up a little bit, but not quite enough to really know what happened. Sometimes you do. And then you're sleepy all day long. And so the most common symptom is daytime sleepiness. So it's a little bit about someone who has sleep apnea.
Sleep apnea affected my work when I had to travel out of town. Any drive over an hour and a half is so monotonous that I would start to get drowsy, and I would have to pull off and take a nap for 10 or 15 minutes, and then I'd be fine the rest of the day. I would say anywhere from 4 to 6 times during a day I would get drowsy, and if I wanted to, I could go to sleep immediately. That was the amazing thing. Nobody could understand how quickly I could go to sleep at any time of day or night.
Sleep apnea means that I would stop breathing for as long as a minute or more during the night. When I gasped for air, it would disrupt my sleep.
So this is the prevalence of sleep-disordered breathing in females. AHI is what we call the apnea-hypopnea index. So it's if you stop breathing or reduce your rates of breathing more than 5 times an hour. And then the EDS, so they have both. EDS is excessive daytime sleepiness. That means you're sleepy during the day. And so if you look at men, it's a little higher. So that's why we talk about it to men more, because men are much more likely to have sleep apnea. Doesn't mean that women don't, it's much more common in men. So the biggest symptoms of sleep apnea are snoring and being sleepy during the day. And then if, say, your partner, your wife, sees you stop breathing at night, that's pretty diagnostic. You often choke and or gasp in your sleep. You'll wake up, because you wake up a little bit and you have to go to the bathroom. You'll end up having to go to the bathroom more, and you'll be tired during the day. The biggest dangers is physically is that you could have you're very likely to have a car wreck if you're sleepy during the day, if you're driving, or have an accident at work. You're not going to do well at work. You're not going to be at your fullest functional capacity because you're tired. You're likely to not have a good marriage just because you're fatigued and you're irritable all day. You can't concentrate. You can't remember things. People get depressed.
A question of life and death. Could you be doing something that's making you a danger on the road and not even know it? What causes tens of thousands of accidents a year? Accidents like this.
Can you help me how many people are injured? I don't know. There's people laying out on the road right now.
Join our volunteers as they're put to the test. Some had too much to drink. And here's what happened with sleepy drivers.
This would be a nightmare driving over the road.
For a lot of us, it's something they don't make enough of. Hours in the day, seconds in the minutes. We're squeezing time dry until someone like State Trooper William Carter looms up in our rear view.
When I'm looking at them and I'm behind them, I'm looking at the same thing. It's the same identical thing.
The veteran Virginia trooper is comparing you, the driver who's just a little drowsy, to the drunks on the road. You both weave across the line. You both speed. Both drive poorly.
Kind of scared me. I saw you go off the road to the right about 4 or 5 times. I'm sorry?
I'm just kind of tired.
Okay, you fall asleep?
It happens every night. Trooper Carter estimates 7 out of 10 times when he stops what he's sure is going to be a drunk driver. It's just someone who's tired. In Texas alone, in the span of just 4 months last year, 11 deaths caused by drowsy driving. In Nevada this March, 8 killed when the driver of this van tumbled right off the highway. It happens to drivers of all ages, on the job and off. Studies show sleepy drivers cause at least 100,000 accidents a year. And the number may be 3 to 4 times that. No one really knows.
So that's just an example that, of what being sleepy during the day can do to you and the people around you. We talk a lot about drunk driving, but you're more likely to die or kill someone else because of driving sleepy than you are from driving drunk. And so this is people with sleep apnea. If you look, 21% of their accidents are 20% of the time they've had an accident that's their fault, and 31% of the time they've had at least one accident. So even if it's not their fault, they're more likely to have an accident because you don't react as well. So you can't practice defensive driving as well. So your factors are, age 40 to 60, overweight. It's more likely in men, 2 to 1 ratio. You have more likely to have anatomical problems like a big thick neck. Medications that make you sleepy, alcohol before you go to bed, and people who smoke, and if you have a family history. So you tend to have high blood pressure much more likely than low blood pressure, and you're more likely to have a heart attack, a regular heartbeat. You're more likely to have a stroke. You're more likely to die of heart failure, or have sudden death, mostly from a heart attack. So if you look at people who have had a stroke or a heart attack or have cardiovascular disease, if you just this is just snoring. This isn't even obstructive sleep apnea. If you snore and you have just one risk factor, like high blood pressure, then you have a 35% chance of having had some sort of event from a heart attack or stroke, so from cardiovascular disease. You're 17% more likely to die. 17% of these people die from that have this. So that's the mortality. If you just have a risk factor, look how much that drops down to 10%. If you just snore, it's almost the same as having high blood pressure or diabetes or one of these other risk factors. And so if you just, the combination of those two is much more, these aren't just additive effects, it's multiplied. So a third of all people with obstructive sleep apnea have high blood pressure, and a third of all people with high blood pressure have obstructive sleep apnea. So let's see, if your oxygen levels when you have, so this is the frequency of regular heartbeat, and this is your oxygen levels at night. So if it's more than 90, only about 22% of the people have a regular heartbeat. But if it drops down to 60 to 69% of normal, of your oxygen level, it's 36% of people. And this is in people with obstructive sleep apnea. Just let me clarify that. If it's less than 60, half of those people, more than half of those people have irregular heartbeats. So this is a picture of a guy who has obstructive sleep apnea. This may be you. Just watch how long he stops breathing. And then he does it again. So this is a picture of the upper airway done by rhinoscopy. Nasopharyngoscopy. So that's where you go back in your nose. You look down in your pharynx with your upper airway. So this is during basically while they were not the same guy, but it's as if you were looking at that guy's upper airway while he's trying to breathe. You can see the pressure trying to pull it open. Moving, it moves, moves, and then he takes a breath. Normally this is nice and open. This is your epiglottis, just here. And you can't really see it that well. Your vocal cords are back there. So this is people with strokes. So this is if you have obstructive sleep apnea. The people with strokes are 10% more likely to have had a prior stroke. If you snore, it's only 3.2%. So people who have obstructive sleep apnea are 10 times more likely than the average population, while just snoring is only 3%. Smoking, as much as I hate smoking, as a pulmonologist, it's only 1.7% more likely to cause a stroke. So just to let you know how serious obstructive sleep apnea can be. So what can you do just at home? You can try to attain an ideal body weight, so lose weight. Sleep on your side. So we can do things, some people will even go as far as taping tennis balls to their back so that they'll sleep on the side. So when they lay on their back, then it'll push them over to the side. Because most people do sleep on their back. And you're more likely to have the sleep apnea. You're more likely to have obstructions if you're sleeping on your back. Avoid sedative medications before you go to bed. Avoid being sleep deprived. Elevate the head of your bed because it takes the pressure of your stomach and shifts it downwards. Avoid alcohol right before bed.
My wife tells me I snore when I'm on my belly.
Yeah. So it's kind of the same. It's not as bad as on your back, but you're also putting pressure. It's the same idea. You put pressure on if you sleep on your belly, just like if it's gravity pushing down, then you kind of are the opposite way. So it can cause a little bit more difficulty breathing. Very few people sleep on their belly. You'll probably get 1 in about 20 people who sleep on their belly.
That's the way I like to sleep.
Absolutely. Yeah, that's a big problem because it increases the pressure in your abdomen.
Well, sleep on your back. I know I never sleep on my back because of the back problem you have.
Yeah, most people who have back trouble sleep on their side because it's just more comfortable.
And yet, so that's good if you have the potential to have that.
Yeah, but I mean, doesn't mean you can't have it. It just means the rates are lower. So I don't want to tell you that's a cure.
Well, no, I'm just saying, so not sleeping on your back, then that does help.
It lowers the rates. If you have sleep apnea, it'll lower the rate. Snoring by itself is typically just undiagnosed sleep apnea or low grades of sleep apnea, to be honest. But it does increase. it increases the upper airway resistance. When it's higher, your body has to do more work to breathe. And so snoring is an elevated upper airway resistance, even if it's not full-blown sleep apnea. And so I do recommend the oral appliances like you see on TV, those mouthpieces, for people who have bad snoring. So, and then stop smoking. Don't forget that. So what can we do? We can do weight loss. We can try to get you to weight loss, which would be, in medical treatment for weight loss, pharmacological treatments. For sleep apnea, very few. Oxygen therapy, which I don't really do if you have sleep apnea. I tend to just go, I prefer Cpap. We can actually stick a tube down your nose to help you breathe, which I don't know that I've ever done that, but except for in the ICU when I was trying to get people to take breaths. Cpap, and then oral appliances. Oral appliances really are only for mild sleep apnea, but they can be very, very effective for mild sleep apnea, and that's those mouthpieces. So what can they do surgically? They can reconstruct your nose. They can take out your tonsils and adenoids. They can take out the back of your throat, which is your uvuloplasty, where they take out your uvula. They can take out the hyoid bone. They can take the back of your tongue off. Now, notice that none of these I'm just going to tell you, none of this stuff works as well as Cpap. So all the stuff that they can take out, except for tracheostomy. That works real well. Because it bypasses it.
What is that? You say
Cpap. We'll talk about Cpap. Cpap is continuous positive airway pressure. So that you put a mask on, or nasal pillows, which is just these little nasal prongs that go up, that kind of they inflate a little bit so that the pressure holds, or a nasal mask, or a full face mask. They have all kinds of different masks, and it blows air. It just blows air. What happens is it stents open the airway, so that you have, it's just like if you take a collapsible hose and you run air through it, well, it kind of holds it open. And that's what your upper airway is. It's just a big floppy hose. So now this is restless leg syndrome, and this is kind of an extreme example. I won't make you watch the whole thing, but essentially that's really bad restless leg. So insomnia is kind of the other thing we'll talk about.
It was first discovered about 250 years ago by a French astronomer that organisms themselves had an internal clock which predicted how the Earth was going to change at different times of day. And the way he did that was to study a plant. It was thought that the sun was what made the leaves of plants open up. And then when the sun went away, they closed down at night. And what he did was to put the plants in a dark closet. And then he opened the door of the closet the next morning, and he found out that the plant's leaves had raised up, even though the organism was in constant darkness. And he realized at that point that living organisms had internal clocks which helped them to predict the changes that were going to occur in the external environment, so that they'd be prepared, so that the leaves of the plant would be opened up when the sun came out, and they would then be able to absorb the sun's rays, as opposed to only responding to things after they happened.
So they're just talking, what they're really saying is that we have our own sleep-wake cycle, and sometimes it gets messed up, and that's what insomnia is where you really can't, you're not able to start sleeping, which is initiate sleep, you're not able to stay asleep, or your sleep's not good. And as a result, you're fatigued during the day. And that result, it's not just because you don't have time to sleep. So there's acute insomnia, which is really where maybe you're worried about something happens, and you don't have a really great explanation for it. And so, and so you just can't fall asleep that night. There's circadian rhythm sleep disorders, which is different people will have that. And what circadian rhythm is where that's the natural sleep cycle from day to night. And so at day you wake up, and at night you go back to sleep. If you're not exposed to enough light during the morning, this can be a problem. So if you, which can be one of the treatments for people who you just can't wake up, is that where we do exposure therapy to light. Sometimes just raising all the blinds. And then you make sure everything's really dark at night. Jet lag, which is obviously where you have a shift in time. So if you fly to England, they have different days and nights than we do, so that when you get there, you're going to be on our cycle instead of theirs. Shift work sleeping disorders is probably the most common thing that you'll see from these these rhythm disturbances, where people who work nights, then they're off a week, they're on a week. It happens to me, and I have a devil of a time going to sleep whenever I work after a week of nights. And it happens to a lot of people where you work a whole week of nights, then you try to sleep during the day for a week, and then you go back, or you try to sleep at night for a week and then you go back, and it doesn't, and you can't sleep, and you feel fatigued as a result. And then high altitude insomnia is from a lack of oxygen to your brain, so you can't sleep.
And the first one there again, the acute insomnia. What was that?
That's typically just when you're worried about something. It happens out of the blue. Something happens. You're buying a new house. You're having trouble at work, and or you have family members. You have a death in the family, and you just can't sleep as a result.
The key is, how do you correct that?
Usually time corrects that, to be honest. It's just waiting in time. We don't usually see a lot of the people for these. But just because it happened, by the time you get to see us, it'll be better. So things that have an insomnia with a longer sleep duration, a longer duration. So inadequate sleep hygiene. So this would be things like, I drink a bunch of liquor before I go to bed, or I watch a bunch of TV before I go to bed, or I watch TV in bed. I lay in bed when I'm not sleeping. So it happens you have this happen with a lot of teenagers, where they just spend their entire life in their room and in their bed, and then as a result they can't sleep because they just hang out in bed all the time. And so the bed's not made for sleeping. So I like to tell people you should only do two things in bed: sleeping, and you know what the other one is. And if you're doing something else in bed, then it's going to cause you to have trouble sleeping, because your brain is associating the bed with things other than sleep, and so it creates a real problem. So idiopathic insomnia is where we don't really know why people have insomnia. That's the most common, is for people who have really bad insomnia, is idiopathic insomnia. That we really never figure out a reason for it. And typically it's associated with older age. As people get older, they have more trouble sleeping. And a lot of times those people aren't that fatigued during the day, and that's where you wonder if it's really insomnia or if it's just age-related sleep changes. I think my dad only was sleeping like 5-6 hours a night, but he felt great during the day, so that's not insomnia. It's only insomnia because you try to go to bed and you're not sleepy. And then you have insomnia associated with other medical conditions, so something's causing insomnia. And these conditions would be medical conditions like psychiatric disorders like depression, neurologic disorders like ALS or neuropathies or things like that. ALS is Lou Gehrig's disease, in case you were wondering. Medications, sleep disorders, and then reasons we just don't understand. Let's see. So it's supposed to be a video. I must have lost my video. Came up the last time, didn't it? Well, just leave you with that.
Does the position you sleep make a difference in sleep?
Yes.
Are you going to tell us that?
Yeah, that's what I was saying. If you have sleep apnea, sleep on your back's worse for you. But really the best thing to do is just to get it treated. And then you can sleep however you want to sleep. By getting a sleep study. So the best thing I can tell you, if you have daytime sleepiness, then you should get a sleep study. You should see your doctor. And you have to start with a sleep study. Because if you have other problems, if you have sleep apnea, then all the other problems really are less of a problem. And then they may be a problem, but you have to address the sleep apnea first. And so, and then also you can add on things. So what we call a sleep latency test. So if people have, you have a normal night of sleep, and then you're still fatigued, what we'll do is we'll put you in a quiet room for an hour, and if you fall asleep, then the faster, you really shouldn't fall asleep if you've had a full night sleep. And so that's what we can show excessive daytime sleepiness. And then you can test for other things like narcolepsy, which is pretty rare, but it happens where people just fall asleep out of the blue, and they actually will be walking and fall asleep. It can be that bad. So, but just sleep apnea is so much more common. We tend to try to focus on that the biggest. I mean, when you look at proportions of people in sleep who have sleep disorders, sleep apnea is probably 80-90% of it.